on this Autistic Pride Day. What is autism? The parents are aware about this and they can identify this change in the child. Pregnant women have undergone any genetic testing during that particular pregnancy. How do we prevent autism from happening? Is there something which we can do? On this Autistic Pride Day, which was commemorated in 2005 to celebrate amongst the autistic people as a day of celebration of the way they live. So what is autism? It is on the rise in India. 1 in 64 children born in India are affected by autism. The reason could be maybe the parents are getting married, the couple are getting married very late, planning their child very late. Elderly couple, definitely there is a lot of genetic mutations which are happening, leading to an autistic child being born. So autism is a condition where the child is affected socially and more of communication of the child is affected. So if the parents are aware about this and they can identify this change in the child very early, I think it will create a lot of benefit for the child. And to understand whether there are any risk factors or predictive risk factors that they can identify that they will have an autistic child in future. If they have a sibling, if the child has a sibling who's been affected with autism, there is more risk that this child can be affected. If there is a history of any genetically affected child in the family like Downs or Fragile X syndrome or any related genetic syndromes, then there is more chance. And if the parents are elderly in age and if the couple have, the pregnant women have undergone any genetic testing during that particular pregnancy like an amniocentesis, CVS, to test the any genetic procedure being done can also lead to a slight autistic variation. So is there any detective test or definitive test which can be done to the pregnant woman to say that there could be autism to this particular child? There is a particular ultrasound feature which can tell us, okay, this baby can be affected by autism. There is a blood test which can be done for the mother where they analyze the 19 RNAs which will give us a 90% accuracy in detecting autism, which is very, very important, but this is not currently being done in every country. It is not still available for everyone, but it does exist. And parental genetic testing sometimes can give us a clue that there could be some genetic mutation which can happen with the child. So these are diagnostic tests which are available. So how do we prevent autism from happening? Is there something which we can do during pregnancy or before planning a pregnancy by which we can prevent autism? Yes, definitely. Number one is your good nutrition, having a healthy diet, more of fruits and vegetables, in adding more of fruits and vegetables in your diet, and definitely exercise, keeping your weight under control, planning your pregnancy early in life, not after you are 35 or 40 years of age. These are simple things which can be done, and also preventing environmental toxins and avoiding food which has pesticides in it. These are simple things which, if we can start from the earlier period, can prevent certain mutations and genetic changes from happening.